right, cool. Well, I'm here with Dr. Jeffrey Gladd. Some of you may know him from Fullscript. Some of you may know him from the Fort Wayne, Indiana area, but we're really glad to have you, kind of on our podcast here, Dr. Gladd.
Yeah, it's great to be here, Ben. Yeah, thanks for having me.
Yeah, so we'll jump right in here. Maybe tell me a little bit about your journey with integrative medicine. I mean, I know a lot of terms nowadays, functional medicine, integrative medicine. As you know, there are so many different terminologies that practices, providers, and even education platforms are utilizing. Maybe tell me a little bit about your journey into integrative medicine and what that experience has been like for you as a practicing physician.
Yeah, happy to. So I did the very conventional track of college, medical school, residency without any thought or consideration of anything integrative related. Call me a skeptic, was definitely in that space.
Sure.
And so did IU medical school, did an incredible family practice residency in Muncie, Indiana. Yep. And then moved back home. I grew up in Fort Wayne. There was an opportunity to work in Columbia City, which gave me the opportunity to do the full spectrum family practice care that I was trained in.
Yep.
So I set up a solo practice in Columbia City, Indiana, delivered babies, did urgent care shifts, inpatient medicine, 40 patients a day, the full grind.
Yep.
And when my second child was born, which is 19 and a half years ago now, I just sort of had a bit of an awakening of, I don't feel well.
Yep.
I keep putting on weight and, drinking 2 liters of Diet Coke and eating drug rep dinners and drug rep lunches didn't resonate that was actually the cause.
Sure.
I had started medication for panic attack in medical school.
Yeah.
I was taking Zoloft out of the drug rep closet on a monthly basis to manage that. And so I wasn't really focused on let me optimize my health, right? That's the buzzword now.
Right.
It was like, I need to lose weight.
Yep.
So trimmed my calories, cleaned up my eating, and 6 months in, lost 50 pounds, mental clarity, off the medication. And I sat there and said, I just did all of this with nothing that I learned from medical school and residency.
Yep.
So I focused on nutrition. And I'm like, I'm going to, as much as I can gather and learn about nutrition, because there's obviously something powerful here.
Yep.
Read Michael Pollan's Omnivore's Dilemma and was a dedicated Michael Pollan follower. And this was before Twitter. And it's, so I was probably on an email newsletter back then.
Sure.
Saw that he was speaking at a conference in San Diego. And it was the same weekend that the American Academy of Family Physicians conference was. Needed my CMEs, got to stay a part of the team in the tribe. But I told my wife, I feel like I need to go listen to Michael Pollan. I've got to move. It was sort of like this, now you look back, and it was like me leaving the conventional space of traditional healthcare and going to learn about nutrition. And lo and behold, it wasn't like, yes, Michael Pollan was the keynote, but it was for Dr. Andrew Weil's Integrative Medicine Fellowship Conference.
Yep.
And so I sat there for 3 days, just jaw-dropping, like everything I just lived is actually a way to deliver healthcare.
Yep.
And so I was on fire leaving that conference. I wrote an op-ed to the Fort Wayne newspapers about the Farm Bill and how we need to focus on improving the food supply. I applied to the fellowship. I had recently left solo practice, just burned out on the financial management of insurance reimbursement and denials. And I wasn't very good as a business person at that time. I'm better now. But I left and joined Parkview, because I just didn't want that piece, right? I was sort of that doctor that said, I just want to practice medicine. And I went to the Parkview leadership and I said, I think we can build an integrated medicine program. Didn't know what that meant, but just thought like, okay, I'm in this system now. I was only doctor, I think 30 or 32 of now what today is hundreds and hundreds. And, Mike Packnett and team, who was the former CEO of Parkview, said, let's do it. Like, let's give it a try. So I got accepted to the fellowship. I started studying, and I launched the Parkview Integrative Clinic. And so they were smart and said, do it 2 days a week and keep your day job back in Columbia City.
Yep.
And, helped me with getting the message out to the community on what integrative medicine was and addressing the root issues and really dealing with the foundational aspects of health, nutrition, mindfulness, spiritual well-being, sleep, fitness, all of those pieces. And that practice got really busy, right? I was on they called it the Noon Extra. So I was on the ABC affiliate at noon every Wednesday answering live questions about this
Sure.
philosophy of care. So the demand for patients was growing. Within a couple months, Parkview said, hey, this is awesome. Like, you've got a great demand here.
Yep.
Yeah, let's make it full time. So left primary care behind. This is 2009. And went full time with the integrated medicine program. And again, 60-minute visits, trying to run that on an insurance billed model. They came to me a year and a half later and said, Jeff, we love what you do. You've got a 6-month waiting list. Can you see 3 times as many people? And at that time, I was going to conferences. I was trying to learn the ideal business model in a health system, which we're still trying to figure out as an industry now, right? It's probably group medical visits. It's, lots of sort of collaborative care. It's remote patient monitoring. You can do it. There are successful models. And I just said, yeah, I know this is going to work in Fort Wayne. I've talked to my patients about stepping out and just leaving insurance and just working for patients. And so in 2010, started GladdMD Integrative Medicine as the practice of my dreams, the one that I was designing in my head for a year and a half. My wife is a nurse practitioner, sort of trained by me at home,
Sure.
felt confident enough to start kind of delivering that care as well. Brought on another nurse practitioner. The dietitian that was working with me at Parkview came over. And ever since, I've just continued to kind of focus on this kind of care. And I built that model in what I called a high-tech, high-touch. As you get into this and you start talking about nutrition, and obviously I was looking different and obviously feeling different, family, friends, hey, what are you doing? Like, help me. And you're helping them via text and you're helping them via an email. Why can't I do that with patients? So sort of built that model of care on that way. My journey to Fullscript is sort of part of that story, certainly. But when I got really passionate about integrative medicine, one of my really good buddies, who in residency got the residency to open an acupuncture clinic at the residency center.
That's awesome.
Which is a tribute to him, but also a tribute to the leadership of the residency to say, yeah, we want to kind of broaden the type of care we deliver.
Sure.
But again, I was skeptical. Right? This guy's supplements and it's acupuncture. Well, I call Steve and I'm like, Steve, this is awesome. Why didn't you tell me?
Right.
Of course he tried. And so we had another buddy who was big in SEO and Google search at the time, which was still early days.
Right.
So we built purehealthmd.com, which was a home for this content, which wasn't really available. There was some, but not much. So I did a good job of sort of recruiting other practitioners from the fellowship who were also starting clinics. Hey, if you write content for us, we'll make sure that your bio page is, highly searched. You can start to kind of announce your practice.
Yep.
And I got this bug for startup culture, entrepreneurism, and fell in love.
Yep.
But my 2 co-founders had full-time jobs that were really good and solid, and so it wasn't going to go very far.
Sure.
We ended up selling that to Discovery Channel. But when I started GladdMD in 2010, I only ever worked 3 days a week because I wanted 2 days for this kind of stuff.
Right.
I didn't know what that meant. I didn't know what that was going to be. I'm at a conference in 2012, and one of my great friends and mentors, Dr. Taroni Lodog, talks about medication-induced nutrient depletion, which is incredibly common. And if you look at birth control pills and metformin and PPI medications, depletes potentially a lot of significant nutrients that create a lot of health issues. And so I said, there isn't an easy way for practitioners to access this information out, we didn't have ChatGPT, we didn't have anything. And so I built Mitavan.com, which was a drug-induced medication-induced nutrient depletion calculator. It was the only one on the internet, free to use for practitioners.
Sure.
Massive database. And so the practitioners and pharmacists put in the medications a patient's on, or a patient could use it. What are the potential nutrients being depleted? And what are the symptoms of that depletion? Which I think actually was the beauty of that, right? Because you are pre-diabetic, and I'm going to start you on metformin. Your blood sugars are now managed, but 3 years later, you've got numb feet.
Right.
Well, most of us in conventional medicine call that diabetic neuropathy.
Yep.
Well, what if it's B12 deficiency? And so that became a really popular tool sort of in the integrative functional world, got rated the top tech tool in the industry. And the co-founder and CEO of Fullscript reached out to me on LinkedIn, and we just became instant friends. Like, he had a huge vision for scaling this kind of care. And I was still growing my practice. They were still starting the business and pretty small. But we became friends. I did a couple side gigs, over the years, but it was always sort of agreed upon that I was going to come on board at Fullscript when the time was right.
Sure.
And in 2019, Kyle called and said, "Jeff, we're buying Mitovan. You're coming on board as our chief medical officer." And at that time, my practice was well established. I had the other two nurse practitioners, really highly productive and seeing a lot of patients. Was able to find another physician to come over and take a lot of my patient load.
Sure.
And I saw the opportunity to, made an impact in Fort Wayne and Northeast Indiana, patients driving in from Warsaw and Ohio and Michigan, but this is North America, right? Fullscript is founded in Canada, but most of their business, over 95% of the business is in the US. Now I have a huge opportunity to really scale this kind of care, right? And you talk about, integrative and functional and holistic, and there's lots of names. It's all kind of the same philosophy, right? But it is a very unique paradigm of practicing medicine. And that's the part that's tough. And as we've really done a great job of growing the integrative and functional practitioners, we're now seeing more and more interest from that traditional medicine world saying, my patients know more than I do. I know there's something here, and not all traditional physicians, but many of them and a growing number of them. How do I get educated in this? How do I sort of beef up my knowledge? But then sort of the quality story, which we'll get into, of the Fullscript catalog and the supplement space is kind of a scary place. And that's how we're raised in our training is, there isn't enough evidence, which is absolutely wrong.
Right.
And you would never know what you're getting, which if you go on the direct-to-consumer market is 100% true. Right. So we built a catalog of only high quality products, and we talk about the quality program. But now we're seeing this growth in that traditional space. But when you talk to these physicians or nurse practitioners or physical therapists, well, I'm not integrative.
Right.
I didn't do the training. So we've moved to talk about whole person care as the umbrella catch-all of any provider who wants a relationship with patients, who wants to talk about these foundational aspects of health. That way we're not playing the silo game and picking one side, because that's part of the problem, right? Like, we should all be collaborating together, which is why we've hit it off so well and had all these conversations. You're doing the same thing in the physical therapy world,
right?
And those other providers is, how do you broaden the scope of your practice with under the scope of your practice that you're licensed to do.
Right.
And I think talking about nutrition and talking about appropriate supplementation fits right in that wheelhouse.
Yeah, no, thank you for sharing your story and kind of your journey to Fullscript. I mean, a lot of times in healthcare, marketing can be a daunting thing. You look and you see, let me run a quick search of providers in my area. Well, everybody uses those buzzwords, integrative, holistic. And then when you break it down, you walk in and it looks the exact same as traditional healthcare, right? So how do individuals or even patients, how do those individuals look for like-minded providers? Like, what are some ways that you found that, I was just in, East Hanover, New Jersey, working with a clinic that the guys work a lot with the pro NFL teams, but they don't have providers necessarily that are individuals who think like you do. But how would someone like that in that clinic be able to go and find somebody who may be practicing the way you and I would practice, but it looks like, the way we practice at face value, but it really isn't under the hood?
Yeah. Well, and I would say there's actually concern on both sides of the spectrum. One is what you just said, which is it isn't all that different. The other is it's so far out there and it's incredibly expensive that, this provider recommended I get $6,000-$8,000 worth of testing done up front, which isn't really the model of whole person care either.
Right.
So it becomes very difficult. And many of these providers have left the insurance reimbursement model as well for the reasons I did.
Yep.
So it's not an inexpensive vetting of the practitioner, right? It may
Right.
cost you $500 to take that first visit. So it becomes really important to know this is a provider that fits what I'm looking for. I actually think it probably goes to, the strongest aspect of marketing as a practitioner is word of mouth from patients.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Torrentia Medical Education.
Torrentia was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Torrentia Tribe, you can also check out some of our events on our events page at torrentia.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.